I'm Barbara Thompson, Voss, and I had several roles at the hospital. My first role was as a candy striper, we called them back then, and our person who was in charge of training us and teaching us what we needed to do was Miss Palmer. I cannot remember her first name. But she was a stickler for detail, from your uniform, wearing your pin, your name tag, your little cap. And we had like aprons. Back then, girls did not wear pants. Nurses did not wear pants. And I had a wonderful time as a candy striper. I have so many memories of things that I learned, which helped me so much in nursing school.
Like what?
Some of the things was there was no mandatory licensure in South Carolina at the time. And we were more like helpers and assistants than just delivering flowers, although we did deliver flowers. We made beds. I made a lot of beds on Saturday morning on Lamar Hall, up to 12 or 14 sometimes. And the other thing that I did when I worked in the evening from 4 to 7 was after dinner, we would offer our patients that we were on the hall with back rubs. And you would never hear that being done today. But I enjoyed that, and the people enjoyed it because a lot of them were bedridden, and it was to help with circulation and relaxation. And so I enjoyed that so much. And I worked 3 days a week most of the time, 2 evenings and 1 Saturday morning. I worked on pediatrics. I worked on ground floor. I worked on second hall and Lamar Hall, and did everything they asked me to do that was in our guidelines for us to do. But like I say, we got to do a lot more than candy stripers do today. So that's some of the things I remember about being. I worked about 1,000 hours the 2 years I worked. So I worked quite a few hours.
How old were you?
I was, it was mine from 1962 to 1964. And this was before the hospital was integrated. The hospital was still segregated at that time. So ground floor, when you go right in the emergency room entrance, the pediatric ward was on the left, the first room, and they had several beds in their cribs, mostly. And the OB was down there, and the general med surg was down there. And the 2 nurses I can remember working, I'm trying to remember her last name, Lois and Florence Bunch. I remember Florence Bunch. She was about the kindest person that I met on ground floor. Very hardworking, never complaining, always very devoted to her job and taking care of her patients. And I remember her making fruitcake cookies for us one year. So I have a lot of good memories about working there. And when I worked on pediatrics, Wanda Stillinger was the nurse that worked in the daytime. And Miss Heath worked in the afternoon, and she was in charge a lot of times. And I don't remember all the nurses that worked on Lamar Hall and second floor, but I remember being there a lot of days, you know. When I graduated high school, I'd already been accepted at the University of South Carolina School of Nursing. And I had a scholarship from Greg Granville Foundation, and I had a SWIN award that I received when I graduated. Excuse me. And so I was able to go to the University of South Carolina. And that's the only reason I was able to go, was because I had scholarships. But being a candy striper certainly helped me know that's what I wanted to do. And I was accepted. Dean Biglione was the dean of nursing at that time. I worked the first summer, we had summer school in nursing school. So after my sophomore year, Mr. Farmer, Joseph Farmer, hired me as a nursing assistant. And like I said before, there was no mandatory licensure in the state of South Carolina. So I was allowed to do most everything that the nurses did except start IVs and give blood, start blood on patients. And my scariest time doing that was when I had to give a doctor who was a patient an injection. So that was a little scary. But I did about everything else from hypodermoclysis and different things like that, medications. I worked 1 week on days when Mr. Farmer hired me. My salary when I was hired was $1 an hour. And I worked 1 week on days, and he put me on night shift. And I got raised to $1.25 an hour. So I worked night shift during the summer and on holidays when I was home from school. The rest of the year, I worked weekends, sometimes 16 hours on Saturday, 8 hours on Sunday, and I go back to school on Sunday afternoon. Go to school 5 days, come home, and do that all over again. But I worked nights from the time I was put on nights when I was first hired until I graduated. And then I worked 3 to 11 shift. And after I was licensed, after I graduated, my pay went up to $3 an hour.
What year was that?
1968. I was at USC Columbia from 64 to 68. And but I worked a lot, and it was a good experience. And I think what a lot of people today, unless you were a nurse at that time, probably doesn't remember that we didn't have disposable things.
Like what?
We didn't have disposable diapers. Needles and syringes were glass. We didn't have plastic IV bags. We had glass IV bags. I remember the first diapers we had in the hospital that were disposable were around 1970. But we had diaper pills. We had a diaper service for the hospital. They didn't do them in the laundry. They were done by a diaper service and delivered to the hospital. And they picked them up. So we had a lot of, experience with not using disposable things, just throwing things away.
How about gloves?
Gloves were disposable. Masks were not. Caps, surgeons' gowns, those were all autoclaved. And I learned to run an autoclave on OB and do things like that when I was in nursing school. I was hired out of college for pediatrics, 3 to 11 shift in 1968. And that's the year I got married also, November of 68. And when I first was working in the hospital, because I worked a lot in the newborn nursery, I got to know the obstetricians and the pediatricians. And so that's how I picked who I would see when I had a need for that, Dr. Jack Paget was one of the pediatricians that was in Aiken before Dr. Barham came. Dr. McManus came, and I remember him coming about 1967. And that might have been when Dr. McNair was no longer working as a pediatrician. Phil PK, I think.
Do you remember him?
I don't. I remember his name. But Dr. McManus came that year. And working in the newborn nursery at night when I was in school was quite an experience, because I was just told to do things and I just did them sometimes. Like staying with a patient that they thought was going to lose a child, because she wasn't far enough along. Well, the baby came along, pounded 15 ounces, and he lived, never went to any other hospital. And he had a little walnut jaws by the time he had gotten out of the hospital. He had these little walnut jaws from sucking, The first year, I believe I worked on OB, and we had 4 sets of twins. A set of boys, a set of girls, and 2 sets, boy, girl. And the other thing is that we didn't have there were no wound care teams, there were no IV teams, there were no respiratory therapists, and there were no physical therapists on pediatrics. The nurses did all that, from postural drainage to croup tents to burns to any IVs that were done, unless the doctor started the IV. We did all that. Mm-hmm. We had some good times though, because I always remember that it was like a family. Everybody supported one another. Very kind, very supportive, very helping. And you worked until you finished whatever you had to do. You know, I can remember when I was in school, staying on ground floor one day till I finished my 14th bed bath and taking care of patients. I always shaved my male patients, and if my patients couldn't take a bath, I always made sure their feet got washed, put them in a basin, in a chair. But I had a lot of interesting things that happened too, you know. Well, after I was out of school, I can remember we had so many children. There were no children's hospitals. If a child had a tumor, cancer, ruptured appendix, meningitis, they stayed right here in Aiken, you know. And we had trachs, and the nurses took care of that too. Changed the trachs, changed the dressing, cleaned it, you know, that kind of thing. My fondest memories when I was first out of school, and Mitsu Brown was an aide. Bernice Lloyd was an aide that worked with me on 3 to 11 shift. And Mitsu was Japanese, so she'd always bring Japanese food to work, you know. And we had a little kitchen there off the nurse's station, was right as you came in. And she would bring things, so we'd have an interesting time with that. But they would work very, very hard. And I'd be right along beside them, you know. And we didn't have electronic thermometers, and we didn't have machines for IV drips. You know, you had to calculate it all on your own. And when I worked the summer in the newborn nursery, I did a chart for administering penicillin to infants. And they didn't have that. There was a lot of things that people don't realize, the changes that were made, even from infant formula, how it changed, you know, from what you would feed a baby even. Dr. Paget's thing was the formula had to be cold. He said because once it reaches room temperature, it grows bacteria in it. And he would check the temperatures. He was a stickler. He would write on your nurse's notes if he had a question about something, or if you did and he liked what he'd say so. You know, I mean, he was very interested in what you wrote, because that depended on how he treated the patient sometimes, you know, what the information. And that's when we had to graph temperatures on a graph sheet. It wasn't all this electronic thing, you know, they have now. But we did a little of everything, you know, that they don't have to do now, because there's somebody, supposedly a specialist, that does all those things. If a patient went to surgery and there was nobody, it was at night, they'd bring them back to the floor to get extubated. So we were the recovery room team sometimes too. I think the hardest part was the burn dressings, though. That was the hardest part, because we had a child that stayed in the hospital 8 months with burns once.
Recover?
Yeah, she did. She ended up after 8 months going to Charleston.
Did she use Dr. Meek's mesh?
I can't recall that for sure, but I remember Dr. Meek very well, because he had wonderful penmanship. And he always wrote with a fountain pen, he and Dr. Roundtree. And I remember helping him a lot. And we did a lot of burn dresses. He'd do micrographs, and he had a burn spray that we used.
Spray?
He had a spray. Mm-hmm. I actually looked him up yesterday reading about the contribution he made to burn patients.
Yeah.
But they didn't go to Augusta. There was no burn hospital. The other girl we had on pediatrics that I remember was that she and her friend thought it would be interesting to see what it looked like on the inside of a gas tank, and there was an old car and they lit a match. And unfortunately her face was there, but she recovered, but that was very hard. And we had one other child, a little boy, that burns pretty badly. Yeah.
How did you learn to work all of the equipment or to do these procedures? Did you have continuing education or did you have classes?
We learned it on the job training. Somebody would teach you whatever you needed to know. And the doctors were very helpful in giving you instruction on different things that they wanted done. I remember Dr. Hall was very particular about scrubs because then when I worked in the hospital, patients were admitted the day before surgery. They didn't come in the morning of, and you didn't do your own scrubs. We actually did the scrubs for the surgeons the way they wanted it done to help keep down infection. And whatever we had to shave. Sometimes we get adults on pediatrics when they didn't have beds and they get admitted for surgery, so we had to do the adults too. And whatever was going on, fractures come in, meningitis, kids. We had the saddest thing, I guess, I don't know why I just thought about that, was we had a baby that her parents actually abandoned her and left her in the hospital because she was like an anencephalic. She had no temperature control over, and she passed away at the hospital. And they came and got her. Saddest day when they could bring that black suitcase to the hospital. It's you never forget that the first time you see it.
Tell me, I don't know it.
The funeral home brings it's like a black suitcase they put the baby in. They don't take them out like they, other patients,
Right.
Yeah. But we had a lot of fun times too. Little parties every now and then, people would have a baby and you'd have a baby shower and, those kind of things, birthdays and go to lunch or something together. We did enjoy each other's company, outside the hospital every now and then.
Yeah, Christmas parties.
The hospital had a Christmas party, but if you had to work, you didn't go. I never went. But pediatrics was on the first floor. When you come in the hospital, there was a desk there for the pink ladies. And Melissa Faircloth was one of the pink ladies that worked there. And when I was pregnant with my son in 1970, she brought me I still have it too. It was a teapot that heat water because I couldn't drink coffee. And she made me this Russian tea stuff. I can still remember that. It was so sweet. We had we had 2 isolation rooms in that floor. And it was just like a little entry room. And one went to the right and one to the left. And we'd have children in there every now and then.
Why?
Just because one child was in there because she was at risk, immune at risk, because she had cancer. And she was 4 or 5 years old. And then you'd have a ruptured appendix or you'd have something, meningitis or, those kind of things.
What about Red Weeks?
Red Weeks. Well, I got to know Red pretty well after I started working 3 to 11 shift after I graduated. And Red she was quiet sometimes, but when she'd tell you to do something, you knew you better get going and get it done, And every now and then I'd get called to the delivery room to administer IV medications from pediatrics. And I told her one day, I said, I don't know about doing this. She said, go ahead and do it. May Bowen was the same way. But Red was always there. It seemed like she was there and you just respected her a great deal. And when, right before my son was born, she had come to the funeral of my brother the week before and stayed with me. And then she came in the delivery room because Chris was born at 3:15, right at shift change, and you want to come. And so she stayed with me in the delivery room. As a matter of fact, Dr. Borick told me, he said, if I put my hands above my head, because back then they used to put you on a strap around your wrist so you wouldn't reach down, or anything. So he said, if you hold your hands up there, and she held my hands so they didn't have to strap me down. And then I was telling you earlier that she had gone to the newborn nursery after my son was born and took pictures of him for me that I didn't know about until about a month later. And but she was always supportive and always encouraging.
She was a supervisor?
She was a 311 supervisor.
About Dr. Bora, what was he like?
Dr. Bora was always kind. He was my obstetrician, and he didn't like things to go awry at all. You know.
He was a good doctor.
Yeah, he was a good doctor, kind man. Yeah. I think most of the doctors who worked in the hospital were kind. Dr. Sewer, I remember Dr. Roundtree, them, because we'd have general practitioners who had patients on pediatrics, not just pediatricians. Dr. Miles had patients sometimes, and Dr. Langston would have patients sometimes. And of course, we had the surgeons who had children having surgery, And so we had quite a few doctors who would come in and out. And the anesthesiologists, they come in and write orders the night before for surgery and that kind of thing.
And the black and whites were just, everybody was together? Or
After 1964, yeah. Mm-hmm. But the hospital was segregated until that time, yeah. Dr. McManus, when he came to Aiken, Catherine was born after he came to Aiken. There's Jean and Margaret, and then Catherine was born after he came to Aiken. And then he was our children's pediatrician also. But I worked for Dr. McManus 8 years in his office, so that was an interesting time. But he would get, we'd have children that would, be so sick, I remember one time he told me, he says, you'd give them a bath whether they were dying or not. That's what he told me one time. He said, I give them a bath because we had a lot of children who came in were from very poor families, and they would be in need of some hygiene. And I remember one time we had a baby that had so much on the scalp till you couldn't find the scalp. But we had a lot of really poor children who came from, poor families and neighborhoods, and you do what you could for them,
How did they pay?
How did they pay? There was, as far as pay, I don't know, because I wasn't in the finance part of it. But, we treated everybody the same. It didn't matter where you paid or you were private. Now, when I was in nursing school, they had a private hospital, and then they had a public hospital, what they called a public hospital, where people who couldn't pay were in another hospital. They did. In Columbia. In Columbia. Yeah, not here, no. Mm-hmm. I know Dr. McManus would never take, if you couldn't pay or if you had Medicaid, even after they started Medicaid, he would just not charge them. He never charged them. But as far as pay, I really don't know, I'm sure the county picked up a lot, for patients who couldn't pay.
And Mrs. McManus worked in the office too, didn't she?
She worked in his office, in the afternoons after whoever the receptionist was would go home. She'd come in and work a little bit. Mm-hmm. Yeah. Mm-hmm.
Tell us about the Nurse Honor Guard.
The Nurse Honor Guard was started about 6 years ago now in the state of South Carolina, but it's a national organization. There are honor guards in every state, and each state kind of has their own guidelines for what, they do. But everybody does the same as far as the service for the deceased nurse. And it can be an LPN or an RN. And if the family wishes it, the honor guard's called, and there's a contact leader for the honor guard in each chapter in South Carolina. Pat Sauls is the lead for the Aiken area. It's called Sandhills chapter, because we're included in more than just Aiken County. We go to like Edgefield and Williston, outlying areas too. And if the family would like to have their family member honored, they contact the honor guard lead, and then we have a call to arms for nurses who can participate in the funeral service. And the honor guard part is usually left to the end, just like they do in a military funeral when they present a flag. And we go to the service. We have white caps, white uniforms, white shoes and hose, dresses, not pants. And we have a navy cape that's lined in red. And we take several things to present at the time of the honor for that particular nurse. And one of the things is a white rose. And then we have a box that has a nightingale lamp in it and a white Bible. And all the nurses who participate in the service sign the Bible so the family has a record of that. And then when we go up, one person will do the introduction to the service. And then we have two people who do the lamp in the box. And the lamp is lit, and we give tribute to the nurse for her devotion to duty and the years that she served. And then we put the lamp in the box, and it's presented to a family member, whoever the family designates. And then the last part is the presentation of the rose, and it's placed on the casket or near if there's an urn or box for the family member. And then we have a last call to duty. Last call to duty, there's a bell ringing, and you call the person's name, and you call them to duty 3 times. On the 4th time, you say your time is now. You served your time, and you're considered to be at rest. It's quite emotional for a lot of people and the family. And I've never heard anybody say anything that they didn't appreciate it. Most people are very appreciative of that. Yeah. We had 5 funerals in 3 weeks, about not long, this like October, November. So, and anybody who was a nurse can have that service.
That's lovely. Mm-hmm. Going back to pediatrics, did people ever volunteer to come and just rock the sick babies or the sick children, or did you ever have time to just sit and hold them and rock them?
When I was a candy striper, we used to feed people too, and we used to take care of we would do that sometimes, but not in a newborn nursery. I don't remember that ever happening in a newborn nursery. And I don't remember any volunteers ever coming to pediatrics. I don't remember that. Now, Miss Heath was when I was telling you about mandatory licensure, I would tell you that Miss Bowen, May Bowen, she worked emergency room. She's quite a nurse. And Florence Heath, she was like my second mother. Because my mom died in 1982, but Miss Heath had passed away in 1980. But she was right there, and she took care of Melissa. When my dad died, she took care of her, because she wasn't quite 2 years old. And May Bowen and Florence Heath, and I'm sure there were others that I don't know about, but they were allowed to take a test and become licensed as an LPN, and that's how they got their license to practice. Mm-hmm. But about volunteers, the pink ladies, I don't remember them ever doing that, or candy stripers, not in a newborn nursery, but maybe in the pediatrics, they may have yeah.
Did you have incubators?
We had incubators, yeah. We did have incubators in the newborn nursery, and we actually had them on pediatrics because a baby that was sick couldn't go to newborn nursery, and they'd come in, and they may have to be in an incubator. But yeah, we did have incubators, but we didn't have a lot of other things. And we did rock and feed babies. We didn't prop bottles. That was one thing you never did. Never prop a bottle. Mm-hmm. And you had to hold them to feed them. They had to be held to be fed. Yeah.
Who were the doctors? So you're from Graniteville.
I was, that's where I went to school.
So who were the doctors in the Valley area?
Dr. Pryor, Dr. Matthews. Those are the 2 I remember. Dr. Royal, yeah, he was down there. As a matter of fact, Gil, Royal, and Ricky Carter were orderlies at the old hospital. I remember that, along with Barney Key and David Green. I mean, you couldn't ask for better help. I don't think I could, if I've searched my mind, I could not find an unkind thing to say about anybody I worked with at the hospital at all, you know.
That's so good.
Yeah. Matter of fact, Carol McDaniels, when she worked day shift with Wanda Stillinger, her daughter was our flower girl when we got married. You know, they moved pediatrics from when you go in, it was on the right-hand side, to the business office in 1969, and or early 70s. And they put the business office in that over the road. You know, they built that structure over the road, and that's where they put the business office. So we couldn't get adult patients anymore once they moved us over there because you couldn't get a bed in and out of there. So we had big cribs and small cribs, and yeah, didn't have that, you know.
And how about when you knew that HCA was coming in? Was that a big transition?
I think a lot of people were unsettled a little bit because they had security, because it felt like the county, you felt more like a family there. And then when this corporation's coming in, everything's going to be private. People worry about having to start over, you know, losing your job or starting over. You have to be hired at this place, you know. I don't think everybody just got transitioned all at one time, you know.
Okay.
I don't think they did.
Okay.
But I don't know that you could beat the county hospital. Dr. J.R. Howell was another general surgeon that did everything, you know, and he was a general practitioner because he delivered my mother's 3 children, myself, my sister, my brother. And then he was still doing that when I was in nursing school. He was still doing that 20-something years later, you know. He was still delivering babies. But a lot of doctors did back then. Dr. Miles delivered babies, and he wasn't an obstetrician, he was a general practice.
What do you know about Dr. Miles?
Dr. Miles, we didn't have a lot of his patients, but I always felt like that if he had a patient that I had a question about, I could ask him, you know, and I could ask him, do we need to consult with a pediatrician about something? Because we did have a child one time that was having intolerance to formula. And we knew there was something wrong. And so I remember asking him about that, because we'd have to start an IV on that baby every time, you know, because they couldn't keep anything down. And that child finally went to Charleston. That's when I found out about special formulas that, you know, that babies, they can't tolerate goat milk, cow milk, you know, soy milk.
Did you have to mix the formulas, or did dietary do that?
Dietary didn't do anything with formula. Formula came in pre-made. Yeah. One time in the newborn nursery, they even experimented with something, and I don't think they kept that system long, because it was where they had a large amount of formula, and it was actually put into a container that was like being breastfed, because it was a round, almost flat thing that you would put so much formula into and feed the baby with that. I don't think that lasted too long, you know. Medication and dispensing changed so much from the time I was in nursing school, you know, till then. Because, like I say, when we didn't have disposable things, you know, you used mercury thermometers, you know, and you know, you used everything that you could either sterilize or, you know, clean, disinfect, that kind of thing.
Mm-hmm.
When we were talking, I was talking to Sue Fields the other day, and she said, "Oh, you remember that?" I said, "Oh yeah, I remember because we had like a utility room, and you had a bedpan hopper in there, and there was actually a cabinet where you kept the bedpans warm, you know. There was actually a cabinet in there like that. And on pediatrics, we only had one bathtub. So you had to there were no private bathrooms, you know. Mm-mm.
So you had to clean the bathtub?
Oh yeah, we cleaned them. I did every job in that hospital. Just about, I can remember because if it wasn't the way I thought it ought to be, I'd do it myself anyway. But I had good help. Bernice, Lloyd, and they were. It was almost like we worked so well as a team because they would help me start IVs and things like that. They knew what to do, In Miss Heath, they all knew what to do. We had one little boy that was a patient there. He had hemophilia, and he'd have to come in every now and then and get some medication. And I remember that he couldn't say my name, Voss. He couldn't say Voss. So Bernice taught him, he called me Boss to Boss. That was my name, Boss to Boss. And precious child. He was about 2 years old. I can remember him from that time. The kids that were sad were the kids with cancer and the kids with burns. And we lost one little boy. He used to love sausage, and he'd beg Dr. McManus, please let me have some sausages, he called it. And he was in Charleston, and he told his family he wanted to come back to Aiken to die. And they let him come back, and he did.
What did he have?
He had a problem with his kidneys and system.
Why so many burns?
I don't know. Some of them were accidental, and we had one we know was deliberate. So, yeah.
Child abuse. Did you see much child abuse in that time?
I didn't see so much. Like I say, that major one that I know about. Yeah. But we did have, ruptured appendix and, kids who, like I said, with trachs and things like that. And kids who get intestinal problems and flus and Haemophilus influenza, meningococcal meningitis, and just a lot of really sick kids, But we had a lot of good experiences where ruptured appendix would go home, and like I say, burns would go home, and children who had accidents and those kinds of things. And, yeah. Luckily, I only had to do the Heimlich one time. And then I had to get something out of a child's mouth one time. But I learned a lot, I guess, from Dr. McManus too, because he'd be patient most of the time. And you'd learn a lot from helping him do different things. He used to also, Dr. Mullins used to come do the bone marrows on the 3 to 11 shift. And they had to have a bone marrow done. And you'd have a little something you'd give him before. But I remember helping him, Bill Mullins. Yeah.
Mm-hmm. He was in the basement too.
Mm-hmm. Yeah, he was in the basement.
Mm-hmm.
Yeah. I tell you one thing about the hospital too. I just thought of that talking about basement, but they had good food at Aiken County Hospital. They did. We always enjoyed going to dinner. We did. We really enjoyed it.
That's what we do.
Yeah, yeah.
Grantville, did they ever go to Augusta Hospital, or did they always come to Aiken Hospital?
My family never went to Augusta until my dad had eye surgery over in Augusta. My mom was sent to Augusta once. Dr. Von Began sent her over there to a nephrologist. But for the most part, I think most people came to the Aiken Hospital. Because we get a lot of outlying, community people coming from, Wagner and different places, mm-hmm. Sally and Jackson Beach Island, down the valley. Mm-hmm. And I guess because their primary care physician is what we call them now, but their doctor, they're the local physician. The general practitioner mostly came to the Aiken Hospital. And we had some doctors that came from Augusta that came over, I guess. But I don't remember who they might have been. If they did, they might have been working in the ER, some externs, interns, whatever they called them.
Okay.
They might have been some of those, but I don't ever remember anybody I knew going over there. Because I had my tonsils out at the Aiken Hospital.
Miss Colley was in
Miss Colley.
Wasn't she?
Mm-hmm.
And Dr. Wyman.
Dr. Wyman, yep.
was
Yeah, I
there.
remember that name now, yeah.
Anything else you can think of at the old hospital?
I remember the flood of April of 1969.
Was
They
that
came to Aiken.
Rollingwood? In Rollingwood?
It came to Aiken. Rollingwood got flooded, but at the Aiken Hospital, that night it was so bad we had water coming down the walls. It had flooded so much at the hospital. Yeah, pediatric, we had flood. I mean, it was a real flood.
So it was a hurricane or just?
It was just storms. It was just rainstorms. I think it was like 10 or 11 inches of rain. It was just real heavy rain that came. I remember Isabel Vandervelde painted nursery rhyme pictures on the old pediatrics ward before they moved us across the hall. And then I don't know whatever happened. I guess somebody took pictures and then they painted over it. But I can remember little Jack Horner, little Miss Muffet and that kind of thing. They were painted on the walls going down the hall. Well, I appreciate the fact that you're doing this because a lot of my best memories in growth and nursing and when I was first married even, are from that hospital, My best friends that I still know today after 60 years, I still know today, And it's sad to have to remember the ones you lost, the nurses that we've lost, And I'm very thankful that I was able to still be here and participate in this.